All right, now let's discuss this further. Then we are joined via Zoom by the Deputy Minister of Health, Dr. Sibongiseni Dhlomo. A very good afternoon to you, Doctor. Thanks very much for joining us here on SABC News.
Good afternoon, Flo, and good afternoon to your viewers at home.
Yeah, Doctor, let's start here. South Africa recording the second case of monkeypox. How worried should we be? I mean, obviously, we now have flashbacks of the early stages of COVID-19, when the first case, second case might not have been as concerning, but it later became a pandemic. How should we react to this?
We are allaying the fears of our South African citizens that it is a very mild disease. It's in Africa prevalent in the west of Africa, the north of Africa. It's been there for more than 20 years. We're just recording and mentioning it in the country because it's the first of its kind that we are getting it.
Yeah.
It's a mild illness. It presents with the rash, lesions on the hands and face and sometimes in the body, flu-like type of an illness with some pain, back pain and muscle pain. And we are actually saying, bring it to the awareness of our population, but not because it is really a severe illness like where we come from. If I were to join you, Flo, in that studio, as I've been making an example, and I don't touch or hug you for the rest of the day, I may still leave you with my monkeypox in my body without actually infecting you. Unlike if I were to be in that studio, cough and sneeze, I would leave behind a bacteria of TB or sometimes a COVID-19. So it is very mild and self-limiting in most cases.
Yeah, I mean, obviously, as we've been seeing some of the pictures that have been going around, whether it's on social media, it's been, the spots or the marks on the skin or the face. Is that, what happens in the worst case scenario? So there are other symptoms that go with the disease, as you've mentioned.
Yes, obviously, it will probably start with a flu-like type of an illness. As you would normally get, even in children, who probably end up with a chickenpox. It starts with like a flu-like illness. Then a day or 2 or 3 days later, you see eruptions of lesions on the skin. Then you can tell that looks like a chickenpox, or then it is monkeypox. Me and you, Flo, would probably not remember or any patient who once had the smallpox. It's only our mothers and grandmothers that can probably tell us how it looked like. But these lesions, if you compare with the pictures we know of smallpox, are much smaller and not as deep as they would have seen on the smallpox. But of course, it is in the family of viral infections that cause some skin eruptions. By the time it comes in, yes, it will show signs that you already have in the body. Yeah. And we would then say the 2 cases that we have in the country are probably indicative that there may as well be another Flo or Dr. Dhlomo out there who probably has not really been detected, probably has actually infected one of these 2, because we now know that there's a local transmission. There's no history of travel of these 2 individuals in the country. All
right. We were talking about really the difference between chickenpox, smallpox, monkeypox, and that, there was some sort of communication about, if you've been vaccinated against chickenpox, then there shouldn't be much worry about monkeypox. And that's certainly a misconception. I mean, you can correct that if I'm wrong. But really, I think we need to get the correct messaging out there about monkeypox and really differentiate between those who would have been vaccinated in the past against chickenpox or smallpox.
Let me start on this one. Like I was saying, me and you, Flo, we don't remember smallpox because it was completely eradicated through massive vaccination that was there in the world. It was ended up eliminated. We are always vaccinating children, immunizing them when they get born, and regularly against chickenpox, but here and there you still get some sporadic cases in one primary school, 2 or 3 children. Therefore, you take them home and then they quarantine them. But you don't get a massive explosion of that, including even those that are affected to actually be having a very severe chickenpox. Monkeypox is a very different one. It's not in the same family. It's a different virus, and none of us have got any vaccination against monkeypox. It's a new disease, like I'm saying, it's been there in Africa, in parts of Africa, West and North. But as it is coming into our shores now, we are experiencing for the first time, no one has been vaccinated against it. We don't have a vaccine as yet, because it has not been the primary focus of the world. We're bringing it because it is one of those diseases that we are beginning to see, but not to worry about it so much as to need to worry about COVID-19, still about TB. Today, we still lose about more than 120 people per day TB infected. They die. But we have not found all the solutions to it. So monkeypox is there, not a big challenge. It's self-limiting disease, new in the world, especially in our shores. So we're just mentioning it to the South Africans, not because it is really an issue of great concern, but we don't want to not to mention it. And then next month, next week, we have more other cases. But you say, but we never told us about this disease. All we are saying, please be alert, Flo. Let us be very strict on our hygiene. Wash hands. Make sure I sanitize. I wash hands when I'm going to be touching or being close, because it is really a physical close contact, the transmission of this virus.
Are we saying, and maybe, to lower the risk of monkeypox transmission, that, maybe a limit on, touching and holding of hands and all of that, as we had been doing in any case because of COVID-19?
Flo, long time ago, not very long, when we started with COVID, I mentioned in some of the quarters that one of the lessons we are going to get from COVID is to actually improve on our personal hygiene. There are many other people who normally go and use the bathroom. They really are reluctant to wash their hands. But COVID has taught us washing of hands regularly before we touch and all that. So if we can maintain or retain those practices, I can be in that studio with you whole day long without touching and hugging you with my monkeypox. I won't infect you. But if I have actually hugged you or touched you, I must then go and sanitize or wash my hands, and therefore you could then eliminate so that you don't take it home to infect any other person. So yes, personal hygiene, let's adhere to it. It will assist us not only against monkeypox or COVID-19, but also even against TB and any other infection that are spreading by contact or by a droplet from one person to the other.
All right, Dr. Sibongiseni Dhlomo, thanks so very much for joining us here on SABC News, sir.
Thank you very much, Flo, and your viewers at home.
All right, that is the Deputy Minister of Health, Dr. Sibongiseni Dhlomo.